Right. I hope we've fixed the IT dramas, and I'm really sorry about this after 20 odd minutes. Thank you to anybody who's still with us online and for those who will join in a little bit. And obviously, the main aim is to try and reach out to as many people as possible. And for those of you who can't join us live, we're recording it and posting, and we'll post little excerpts of the webinar as well. So just to introduce myself, my name is Tim Bates. I'm the senior partner here at Fort House Surgery in Walton-on-Thames, and I will be joined by Jon Murrell in a little bit. We're going to talk a little bit about well-being and our growing interest and effort around the early intervention and detection of illness and prevention of ill health. Before we get going, just a couple of little housekeeping points, please, if that's okay. This is an interactive session. I've got two moderators online. We'll be able to see your questions coming in, so please use the chat function. I think everybody is muted. We obviously will like to try and keep the language and discussion to those that we can repost and that we would normally share together. Obviously, please don't ask us medical questions. This is a public event, and it would be obviously unwise to share any personal medical information. If you do have medical questions that you need answering, then please contact us through our website, which is forthousesurgery@nhs.net. And sorry, that's the email address, isn't it? So it's Fort House Surgery. Just Google us and you'll find us. Really today is trying to just give you a heads up as to what's been going on in the surgery in the last year, basic functioning of the surgery, and try and answer any questions that anybody might have. So there'll be two parts. Number one, I'll be rabbiting on. Harriet's next door. Questions will get fed back to me and we'll try and answer them as best as we can. And then Jon Murrell, our paramedic practitioner and operations manager, who's leading our wellbeing section, is going to join us as well to talk around some of the exciting work that we've been doing here in the last year. So really, we thought we'd just give you the rundown as to 2025. You can see that my team here have officially declared it Christmas and the decorations are going up. I think we're all a little fed up with the John Lewis advert at the moment, but only another 4 weeks to go of that before the Boxing Day sale adverts are on. This year has seen quite a lot of activity and quite a lot of people joining and leaving the surgery. We have received over 67,000 emails and requests for help. We have offered over 46,000 appointments, and as you know, we have a digital first system where you contact us online, and for those patients who are unable or just prefer to call us, you can still call us, and our team here will take that inquiry and put it online, so we can now accurately measure our activity and begin to match up some of our services against that. That means that we've had 35,000 plus in-person appointments, and when you look at our activity here, once you add everything up, 1 in 2 inquiries are handled remotely, and essentially 53% of inquiries result in a trip to the surgery. And we're obviously very keen to try and minimise the use of cars in and out of Rodney Road and the shared parking facilities. But when you look at our data, almost 50% of people have their needs met without having to come into the surgery. And obviously we encourage people who do come into the surgery to try and use all forms of public transport, cycling. We've got the electric car charging points, we've got the bicycle racks outside, and we know that by being here we were far closer to our central population. So hopefully more people will be able to walk in to come and see us. And I suppose then the question is, who are you going to see? We all know that Dr. Redfern left after 30 years of service and we miss him terribly. I can tell you that he is in good health and enjoying retirement, and I was lucky enough to catch up with Richard and David Ratcliffe, our previous senior partner here, and they certainly are painting a happy picture of retirement and enjoying their spare time after all that hard work. We also said goodbye to Dr. Jones and Dr. Tanner. Amir Stevenson from our reception team left us this year, and also Katie Pollard is moving on to new work locally in Walton-on-Thames. We're sorry to see them go and we wish them well. But the good news is we've had some new people join our team. Emily Anderson, Dr. Emily Anderson, Dr. Vicky Gavins, who comes from a very well-known medical family locally, and Emily Ruiz. They've all come to strengthen our clinical team here. And we're delighted to welcome Leslie Ann to our team, and also Nikki Jones, who've joined our reception team as well. And lastly, we have Kirthi Achu, who is helping us with data analysis. We hold quite a lot of information here, and we're really keen to understand what our data, by the way, it doesn't get leaked outside, what we're doing here stays here, just to try and understand how people use our services and how we can improve your experience as patients. The partnership changed. So on the 1st of April, after Dr. Redfern left, we were delighted to welcome Charlotte Bukovic, who is our nurse practitioner here, to the partnership, and also Dr. Sarah Teague. So your partnership here comprises 4 doctors, 1 nurse, and our practice manager, Harriet. In addition to the team, Julia, who's our deputy practice manager, welcomes Claire Smith as our one of our new senior receptionists. And our social prescribing goes strong, but Georgie has been on maternity leave, and congratulations on the new baby, and will be joining us again, we anticipate, in February. And thank you to John, our operations manager, who's joining us, who has been running our wellbeing section, social prescribing section as well. So what have we been doing here? Well, I suppose we'll stick on the maternity theme. As you know, we had a very successful women's health webinar recently, and we have built our women's health offering here. So we have 2 specialist nurses, Ruth Clark and Mandy Wilson, who are working alongside Zoe Hollowell. Vicky Gavins has joined the team, and Sarah Teague. And we're offering around 45 routine booked women's health appointments per week, both face-to-face and on the telephone. And we're also running at least 1 coil clinic a week, with an extra coil clinic every other week. So the women's health team is growing. Ruth Clark now offers pessary fitting. We are one of the few practices in Surrey to offer that, and that's useful because it involves fewer trips up and down to St Peter's for our patients as well. We have been concentrating as much as we can on trying to improve health and well-being for our community, and we were delighted to become a Trussell Trust Food Bank donation centre. You'll see as you walk into the surgery that there's a large crate there, and if you are visiting the surgery, particularly at this time of year, and you do have anything spare in your cupboards that you would be happy to gift on through the food bank system, we have a collection receptacle, and the Trussell Trust come and collect from us. We also are still working with the Citizens Advice Bureau on the a project to integrate into general practice. We are the only practice in Surrey with a Citizens Advice on site, and we are one of 2 practices in the entire country where we work shoulder to shoulder with the CAB. We're delighted to say that funding has been secured for our 3rd year now. We are trying to produce as much data and evidence around impact. Certainly we've got lots of qualitative data where we've been able to make individual differences. I know this week celebrates another success, working with a housing association and a family in unsuitable accommodation and seeking relief from mould. And John will share some of those individual experiences as well. And Kirthi, on our data analysis side, is going to be looking at the impact that project has had, because hopefully we can share the learning around the impact, and it may well be something that could be rolled out to other surgeries to benefit other patients through Surrey. We have developed our wellbeing wall online. I really encourage you to go and have a look. And also, if you are aware in the community of any schemes that are free at the point of access, really designed around networking, communication to overcome social isolation, and we're very keen on getting everyone moving here and fit. If you have any recommendations for us, then please email the surgery and let us know, and we can get those details up on the wellbeing wall. But the wellbeing wall through the website has been a brilliant resource for us to direct people to other like-minded groups, other like-minded individuals, whether it's anything from singing in a choir to joining the Riverside Rebels to picking up a paddle racket for the first time through Easy Paddle. There are lots of options that we're building now to try and keep people connected and keep people moving. And with that in mind, having had such a great energy around women's health, we hosted 2 men's health events this year as well. One in June, one in September, designed to coincide with Men's Health Week and also Heart Health Week. We screened 40 men. It probably won't come as a huge surprise because we know the headlines and we know the direction of travel, that two-thirds of our men were overweight or obese. And obviously, we have lots of advice and lots of support for people trying to build healthier lives. 10 people had slightly dodgy blood pressures. We've certainly gone on to find one person who needed medicating. And we found 4 people with pre-diabetes. And identification of pre-diabetes gives us the opportunity to uh, uh, avoid diabetes in later life, and obviously the downstream consequences of premature death or injury from stroke, heart disease, kidney failure, loss of limb. And so that is quite surprising that 10% of our population had pre-diabetes. Powerful intervention there. One person with an irregular heartbeat, and obviously prostate cancer with Chris Hoy and other celebrities is very much in the media as well. We hosted a webinar with Professor Steve Langley, who was at that point chair of the Surrey and Sussex Cancer Alliance, and has been authoring papers on national programs for PSA testing. And of the 40 men who came, 26 were eligible for PSA testing, and we have found one person with prostate cancer. So another early identification of illness and another opportunity to reduce ill health and obviously very traumatic outcomes as well. We're keen on supporting carers. John will talk to you in a little bit about the carers support group that we hosted for the first time here in the hospital, and we'll be rolling out further interventions for carers and further support for carers in the new year. And we're also working with Elmbridge Can, who are a refugee charity, looking at supporting people who've been displaced and are in the UK for the first time. And from our perspective, we've been delighted to support 2 young ladies from Afghanistan who are interested in careers in medicine and dentistry. So at every level that we can, we're keen to get involved in community services. There is the Elmbridge Community Forum, where we meet with Elmbridge Council and the local councillors, and also the Excel Centre. Quite a bit of work with the Excel Centre, the Fortitude Fund, where we've been able to give out 10 free gym passes to people who would benefit from adding exercise to their life, and that's a combination of training and discounted rates as well. And obviously the Excel team came to one of our men's health events as well, so lots of promotion around activity. The Thrive Together project has come out of our work with local council, and it's a collaboration between Fort House Surgery, the local Elmbridge Council and Public Health Surrey. We've taken 20 volunteers, all female, who I'm pretty sure between the age of 40 and 60, who have pre-existing medical conditions, who might benefit from social interaction and opportunities to exercise. And over 12 weeks, they've been offered social emotional support, but also stretch and activity type exercises, kind of yoga Pilates type classes. And the outcome of that is going to be a jointly produced piece of artwork that we're looking forward to unveiling, or hanging and then unveiling in Fort House Surgery. So there'll be a visual representation of that project to look at when you come into the surgery. And the analysis and the outcomes of that will be worked through with Public Health Surrey to see, again, if there is a value, which we suspect there is, in trying to get our patients moving. In other news, I think people will be aware that our planning restriction has been lifted from 13,500 to 16,500 patients, and details about registrations are on our website. We have worked quite closely with our local councillors, and we're really grateful to them for their support, and obviously the planning department at Elmbridge, and we will do our best to be kind and not noisy neighbours. As you can see, we take minimising footfall to the surgery very, very seriously. We have had some challenges. In the last 6 weeks, our clinical workforce has been cut to about 75% of what you would normally expect, and that's been during a flu and norovirus epidemic. So things have been challenging, and I'm supremely grateful to my senior management team, who really comprise Harriet Reid, the practice manager, Charlotte Budkovich, my partner here, who runs our nursing team, Jon Murrell, our operations manager and paramedic practitioner, as well as Julia, our deputy practice manager, to try and minimise the impact. Some people will have had appointments moved, and we're really sorry, we don't want to do it, but we have had some very unexpected serious illness in colleagues' family members, and unfortunately a couple of our colleagues have lost family members rather unexpectedly as well. I'm sure you will bear with us and sympathise as we try and move appointments around to try and minimise your disruption, and obviously allow our colleagues time to heal through some of the traumas that they've been experiencing, and we'll get them back to work fighting fit and hopefully get back onto an even keel fairly soon. I think one thing I wanted to share with you is kind of that's what we've achieved. Well, what's our strategy? And you'll see today that our strategy for 2026 is built very much around continuing our work in the community. We'll talk a bit more about our preventative health work as we go on. We'll talk a little bit about the social determinants of ill health as well. It's an area that we've become more and more aware of. You'll see it being written into the Claire Fuller stocktake for the future general practice, which has been incorporated into the NHS 10-year plan. I think most people will be aware of some of the buzzwords around the 10-year plan, trying to move services from hospital closer to home. We've got our role to play in that going forward. Trying to move away from analog to digital. You will see how Fort House has managed to embrace digital technology from just before the COVID pandemic. And we will continue to try and improve our service here and make it as inclusive and as efficient for you as possible. We want to run more screening events. We're delighted with the success of our screening events so far. Clearly, there's more work to do, and opportunistic testing for men is clearly a successful way of engaging. And I think also working more with our various ethnic communities about whether we can run outreach services through the surgery for our patients as well. So lots of conversations there. We're looking at supporting you as you manage your illness and as you manage the illnesses of loved ones around you, to support our carers. Very, very keen on trying to get people as moving and as connected and as active as possible. The digital technologies will evolve. We're looking at a new clinical system, which probably you won't recognise much difference here, but potentially could be cutting down 30 to 40 minutes a day per clinician of frustrating whirly wheels and dropouts and systems not talking to each other. Thankfully, someone's invented a system where it's all in one space, so we're looking at commissioning that hopefully in the new year, subject to the usual approvals. And in terms of supporting people with IT, we're going to be running a drop-in session for people who would like to be a bit more digitally literate and use our online services more. So watch out for that one. We will be advertising, obviously, in the paper format in the surgery as well as online. Luckily, Elmbridge has very high rates of digital literacy. I've been told it's as high as 88%. So we do have a community who are happy to engage with us digitally as well. There's a couple of key messages before I get on to some of the questions, and we've had some pre-submitted questions. Thank you. And if anybody would like to pop something in the chat box, Harriet will come and give me a poke with a stick and make sure that we answer it properly. A couple of key messages from us. The NHS app has been a fantastic success, dare I say it, from our point of view. It's given you more power over your data, over results, over letters, and you'll be able to see contents of clinical records from when the integration started. There are a couple of things, though, that I think I just need to make people aware of. I think we'd like to talk about results, because when you look at your results online, there are two things to look for. Number one is the medical comments, and number two is the reference range. When we, as your clinicians, look at your results, we are looking at the reference range, we're looking at the results, and we're also thinking about the presenting problem. You can only analyse a result according to the context in which it's taken. Why did we do it in the first place? 95% of normal values lie in those reference ranges, and usually there are stragglers either side of that, above or below a reference range, usually 2.5% each side. This is the world of statistics that my eldest son can tell me more about than I can remember now, and it doesn't mean that if your result is outside the reference range that it is abnormal. So if you see something that has a little red mark or an exclamation mark or is outside the reference range, but your clinician has marked it normal, it's in full awareness that it has either no direct relevance to your clinical condition, or it is perfectly acceptable to sit outside that normal reference range, because it applies to 95% of a measured population. If you do have questions, obviously we're happy to answer them, but I just would like to defuse that little tension, because I know that looking at results outside of reference range, people think that they have abnormalities, where actually they're perfectly fine, and we want you to live your lives as if you're perfectly fine. If you're perfectly not fine, don't worry, we will be telling you. We obviously are very reliant on our emergency clinics here. We work hard to keep appointments in the surgery, and we have to be careful to try and match the on-the-day demand for appointments to our capacity. We can't block everything out for on the day. We can't block everything out for pre-booked. We are really reliant on a network of surgeries providing extra cover, and these are known as acute illness clinics. They did initially run out of Chertsey, and we managed, with working with our local providers to get, and obviously other local surgeries, to get clinics running in Walton-on-Thames. So you won't be surprised if you are presenting with an on-the-day problem and you need assistance that day. You won't be surprised now to be offered an appointment either in Walton or potentially up in Chertsey as well. This really helps us manage our flow, and I think without that we would have a much more critical problem trying to get everybody seen on the day who needs urgent help on the day. So if you are asked to go to a different centre, please don't be surprised. You are seeing medically trained professionals who are working in general practice shoulder to shoulder with us. We also, thankfully, have now got one of those clinics here on a Tuesday and one on a Friday. So the travel to other centres is gradually improving. We are trying to improve the offer here as well, but I'm really pleased to say that currently this winter we're able to offer some of those extra appointments where you might have had to go to a different centre in the surgery here, but not every day, and we won't have capacity to accommodate everybody. If you are asking for an appointment, particularly the same day, it's almost impossible for us to work around a diary and offer you a time of your choosing. So we would ask just for some charitable flexibility. If you have to collect a child from school, if you have to miss a work meeting, it's very challenging trying to offer emergency services to 13,500 people. Firstly, try and find an appointment that day, but then at a time of your choosing. We would really appreciate, well, in fact, let's say we were grateful for people who have already shown the flexibility. We certainly would appreciate flexibility in managing diaries to try and get you seen and get you accommodated. And sometimes what you might think is a routine appointment, for us, we go, no, we've got to take a look today, because there could be a medical condition behind that could be serious that you might not have identified. So again, please don't be surprised if you're asking for something a week down the line and we say, actually, you probably ought to get that swollen leg and breathlessness looked at today. We will find you that appointment today. We will get you seen. Questions. I don't see any extra questions going on, which is fine. We'll continue with our pre-prepared flow. If anyone does have any questions, that chat box is still active and going. The first question here is, why are we taking on more patients when it can be difficult to get an appointment with a clinician of choice? I kind of got to flip that and say, how healthy has it been for our business to be operating under a restrictive cap for 9 years? It's been very challenging. Businesses naturally need to grow. We need to be able to bring in revenue and income, and we need to be able to make sure that that will then fund services for you, as much as some people can cynically say it might fund my jeans fund for Christmas or something along those lines. But the reality is that a business that cannot grow cannot thrive, and we need to be able to find our natural settled state. That is the bare finances of it. But also, we think that we have a product that we can roll out to more people. We are very proud of the service that we offer here. We're not going to pretend it's perfect. We are very much in listening mode, and we are very much open to suggestions for improvement, and where things have gone wrong, we do need to hear about it, and Harriet and I review all of our significant events and all of our complaints on a regular basis to pick up themes for service development. But ultimately, there are no other GP practices who are operating under a restrictive cap anywhere in the country. This is unique to us, and it was part of the process of us trying to come out of some premises that were very, very restrictive and into these wonderful premises that you see behind me now, which allow a better operation. And it's not just about core basic GP functioning. We've been able to bring in extra services. We've been able to bring in aortic aneurysm screening for the whole local area. We've been able to bring in liver screening, certainly for our patients, and this is a pilot that may roll out to a wider area. We've been able to bring in our GPIMS mental health service. We've had perinatal mental health come in here as well. So we've been able to bring up bring in, I should say, other services that we weren't able to in our last practice. So it goes a little bit beyond just raw patient numbers and how often we see you every year. And in terms of clinician of choice, it's very interesting. Continuity makes a difference. I've emphasized this in previous webinars. It makes a massive difference. I've been here 21 years, and we're really proud with our colleagues here in the length of service. They've managed to stay with us through thick and thin, and certainly it's been a few challenging years. But if your team know you, if your GP knows you for more than 15 years, your risk of dying from everything drops by 25 to 30%. Your risk of going to A&E drops. Your chances of going to outpatients drops. Your chances of needing to go to surgery drops. And actually, you are more likely, because you trust us, to listen to some of the health advice that we'll be giving you in a minute around not smoking or reducing alcohol and so on. So outcomes improve. The direction of travel above us has not been kind. The way we've been managed really for the last decade and a half has not been kind to general practice. You've heard me say that there are fewer GPs, that there's been less investment, that last year general practice had the lowest share of the NHS budget in the history of the NHS. That was the legacy of the last outgoing government. So we have been weakened significantly, but in amongst that, we are still trying to deliver the best service we can, and we are trying to focus it on continuity. When the when the forms come into the triage desk, we do try and match people up to patients up to doctors that they know, and that's a real good opportunity for us to try and emphasise continuity. We've also changed, by the way, our doctor-initiated follow-up, I should say. So we used to be asking people for follow-up to go online. Clinicians now can actually just fill out a little ticket, give you the ticket to take to reception, and then reception can book everything. So we've made your follow-up appointment easier, and then that will enhance continuity as well. What I would like to say is that the last Conservative government and this new government have both published roadmaps for NHS for the NHS in England, but also general practice. Both documents mention the word access, getting an appointment, over 100 times, and both documents mention the word continuity 4 times or 8 times. It's single figures. So the message about continuity of care is still not being received or listened to or actioned higher up, but we are taking that seriously, and we're trying to build continuity into our systems. So yeah, it can be difficult to get an appointment with a clinician of choice. You may have to wait. Access always overrules continuity, because if there's something serious, we have to get you in and get you seen. And I totally trust all my colleagues here online to be offering you the best service possible. But where continuity is possible, you might have to wait a little bit longer, but then that facilitates, that allows that relationship between doctor and patient to grow. And I feel that's something that's been eroded through successive years of mismanagement and the multiple revolving doors of health secretaries. Sorry, I sound a bit like the Grinch at Christmas rather than giving you an upbeat message, but we are working on continuity where other people are not. There's a question here about the Health Hub and the Elmbridge Hub. I had someone doorstep me about it just recently as well. I think to understand our position on the future of the Elmbridge Hub, it's important to understand our relationship with NHS England and NHS Surrey. So the premises that I'm sitting in, we pay to maintain. We pay for the cleaning, bits fall off, we fix it. We want to convert a shower room into a phlebotomy room. Your partnership is paying for that, and we're funding it with the proceeds, obviously, from the surgery. But the actual rent, which is a 6-figure sum, is paid for by NHS Surrey. So they pay for the estate that we sit in, which basically means that if there are plans at a higher level than us where they would like to move GP surgeries into one site, with the idea of trying to bring other services such as physical therapies, nursing services, radiology services, interventions, and so on under one roof, then very much we kind of don't have a huge amount of choice in this. So our policy here is to engage with the process to make sure that if we are required to move, that it looks right, that it works for us, because if it works for us, it's going to work for you. So the hub, we don't have a front seat in, but we are in the back seat making sure they're not doing anything too chaotic. But ultimately, the choice for all the practices about whether they stay or move comes down to who pays the bills, and we're dependent on the health authority for our rent. One little bit on missed appointments. I'm not sure if that's a question or just something from my team. there was a way of sharing my screen, which I'm not sure I can, but I can tell you that 3% of our appointments were missed last year. That means that 570 appointments with clinicians here were missed. Each clinician has a minimum of 30 appointments a day. So that's 19 days of GP services that were wasted, unfortunately, through missed appointments. I think you'll know where the plea goes, which is we understand things happen, but if things happen, please, please, please give us some notice, even if it's 5 or 10 minutes, because we can easily, well, people will tell me they can't get an appointment. We can sell that appointment 10 times over. And even if it's sort of with 5 minutes notice, what we can do is we will cancel that appointment. And if there are calls waiting with the duty doctors, we can move those in. So we can just share the work amongst the team. And it just seems in difficult times, certainly the hardest 3 years of general practice that I've ever known, in very difficult times, to be wasting clinical time here seems like a terrible shame. So a plea, please give us as much notice as you can. An update on private prescriptions and tests. There's an update on our website, so please have a look at that. The partnership has decided that we can't do blood tests for external third-party organisations. Now, for NHS organisations like the Royal Surrey County or the Royal Marsden, your doctors and nurses can give you forms. We can use those forms. We can put that blood, we can take the blood for you, and we can put that into the system so the results go back to your clinicians. The main issue here is around safety and clinical governance, because if we're asked to perform a test, one common phrase amongst medics here is serum rhubarb. If I'm asked to do a serum rhubarb test and we can get your serum rhubarb results, it literally is rhubarb to us. We might not know why that test was commissioned, how it might influence your care, what your clinician was going to do with it. And this is under the auspices of what we would refer to as clinical governance. So if I do a test, I know why I need that test. I know why you need that test. It's my job to handle that result and action that test and make sure that you have no interruptions to your care. But if somebody else is asking for a test, we can't safely handle it. So you may find that if you're asking for blood tests from third-party organisations, that the surgery may act as a technical phlebotomist and take the blood so long as it can get to the right place. But actually, we may not be commissioning the blood test or taking it on behalf of someone who's not going to be able to receive a sample, and we may just have to refer you back to your external organisation like private doctors and so on. It is safety more than capacity, and safety is something we take very seriously here. On that, we also probably day to day, about 15% of our clinical workload is holding people who are on waiting lists. It has a massive impact on our workload here, and we would ask any patient who is chasing any hospital results, please to contact the hospital for exactly the same reasons around clinical governance and safety. We get lots of requests for MRI scans that we didn't commission. In fact, we're not even allowed the keys to the MRI scanner. And we do get some slightly lazy kind of knockbacks from the hospital saying, get your GP to check this, get your GP to check that. But the reality is that if the hospital commission a test, the hospital action it. And if you are having difficulty of getting hold of clinical departments, and we know because we phone them too, how much those phones ring and ring and ring. If you can't get the help you need, call the Patient Advisory Liaison Service. The NHS loves an acronym, as does politics, and the PALS team are there to help you navigate to the care that you need. And please don't be upset if your clinical team here give you the details for PALS, and I wouldn't mind betting that we might be circulating the details of PALS for our local hospitals off the back of this webinar, so that you can get your actioned results safely. Couple of quick questions, then we'll move on to John, hopefully. To free up clinical time, will you be moving to an AI note scribe tool? That's a fantastic question. We are, I know that I'm very keen on this, but in my opinion, we are obviously in a digital revolution, which feels very much like the Industrial Revolution 200 years ago. Our lives are changing hugely in ways that we hadn't ever really anticipated. And these tools are coming at us thick and fast. There are some governance issues to consider around data safety, security. Some of our clinicians are already using a tool called Hive, and I personally have tried a tool called Tortoise, but because it was a bit clunky and it's a bit cut and pasty, it hasn't really got anywhere. We will probably migrate to this new system in March, and one of the advantages of the new system in March is that it has what they refer to as AVT, which is ambient voice technology, and that will help us with our contemporaneous record keeping. So the answer is yes. Now, if we are officially moving to an AVT type tool, we will make everybody aware of it, and we will navigate the challenges where people are not keen to be recorded. But every single phone call that we make out of here is recorded, and when it comes to data, release of data under subject access requests, you as patients are able to request the contents of telephone calls as well. So if it's already happening on the phone, then there's no reason why it shouldn't happen face to face. So it's very likely. Right, if we need an appointment for a family member, for someone who's struggling to get to the surgery, is there anyone who can come out and do home visits? We love our home visiting service. There are lots of things that changed in COVID that we have quietly lost. There are lots of things that changed in COVID that we have embraced, and we now consider parts of our team and parts of our family. I would like to give a massive shout out to Chris and Nick, and is it Lee, John? And Lee, and our other paramedic practitioners who do our home visits for us. Urgent home visits, we can get someone out to you the same day. And where we lack capacity, we will move some of the deck chairs on our Titanic and get people out as well. We also have facility for pre-booked home visits with clinicians, because we're aware that not every home visit needs to be urgent and on the day, and we are keen on maintaining continuity, helping people manage frailty, long-term conditions like cancers. We want people to be able to die comfortably at home. So much as the Daily Mail might tell you GPs don't do home visits anymore, they certainly do here at Fort House Surgery by arrangement. But for on-the-day emergency requests, we are reliant on our supremely talented paramedic team. So yes is the answer to that one. Oh, a lovely compliment. Thank you so much. I won't say names, but I really do appreciate that. Thank you. Would this be the case if a consultant asked for blood tests to be done in relation to an ongoing long-term condition? Any request coming from our NHS colleagues, we are asking for them to issue the forms for us. And I hope that my earlier attempt to give you an idea around the rules around clinical governance and patient safety will be an acceptable answer to that one. So yes. Good. John's here. Move in, John. Do you want to come in that side, actually? Is that okay? Yeah. I didn't give you warning, did I? So, thank you for joining us. Now, can we find a way to share our screen? That's the first thing. We'll just take a quick 2 minutes, because our screen share was here in training. As you know, we've had some issues. Can you see any way, John, to do this?
No, but I think I can summarise what we had on the slides anyway. So
okay, so let me do a quick introduction. John, you've seen his bio online. John, you've been with us how long now?
3. I started when we moved into this building, so
yeah.
March 2022.
We are thrilled with our allied healthcare practitioners who've joined us. Our nursing team, you can see our specialist nursing team who've joined us, and John was one of our first AHPs who's joined us as well. John has taken on the role of operations manager here, and is instrumental in running the day-to-day functioning of the surgery, our clinical teams, who's here, the appointment book, how we balance our on-the-day requests versus our pre-book requests, and a myriad of other things that I'm sure I've left off. So thank you so much for joining us. I did have a couple of slides. I just wanted to let people know why we're interested in the social determinants of ill health, and why we are trying to build a social prescribing department, and why we are trying to improve people's access to social contact and to physical activity. I first became aware of Professor Sir Michael Marmot, who runs the Institute of Health Inequalities, through my work with mental health and Surrey Heartlands ICB when I was clinical lead for many different areas there. his work started in the late 70s when the government asked him to look at why civil servants were having strokes. They thought it would be stress related, they thought it would be blood pressure related, and when he analysed all the data, he basically found out that the lowest paid people had the worst health outcomes. And that then led a huge interest through the 80s, culminating in reports in the late 90s for the Blair and Brown government, looking at what makes people unwell. And he generated 8 key principles that we can look at essentially as human rights that we would like to be afforded ourselves, and how can we build these into our societies to build healthy populations. And there were 6 Marmot principles. He's just added 2 more to reflect the changes of the world as we have it. Number 1 is to give every child the best start in life. Secondly, education and lifelong learning. Thirdly, good, safe employment and good working conditions. Fourthly, that everybody has the minimum income to live a healthy life. 5 is looking at healthy, sustainable places to live and work. This covers housing as much as occupational exposures. And then a preventative approach to healthcare, which is what we're going to be touching on. The 2 new Marmot principles, free from racism and all forms of discrimination, and then also to work with climate change and sustainability and United Nations Sustainable Healthcare Goals. His work has now been adopted by local governments up and down the country. There are notable Marmot cities looking at regeneration, such as Coventry and Leeds, and whole counties like Northumberland, who are building Marmot principles into their civic structures and their social care structures. And when we look at social isolation, I mean, why are we interested? I was just doing a quick bit of research before we started. There's a very good TED talk called How to Live to 100. And when you look at the top 10 factors as to how to live to 100, number 2 is your close relationships, your friends, your family, the people that you can call up and ask for a loan or a shoulder to cry on. And number 1 is opportunities for social interaction. And that means strangers. It means interacting with your neighbours, with people in your streets. And those are the 2 biggest protective factors that can help us live longer. Social isolation kills more people than smoking and obesity combined. Social contact will save more lives than flu shots. Social integration and close relationships, I said, are the top 2 predictors of long life. People who are isolated have a 29% increased risk of heart attacks, a 32% increased risk of stroke, increased risk of diabetes, weakened immune systems. There are links to high blood pressure, obesity, links to chronic pain, poor sleep, physical inactivity, and that's before we've even touched the mental health impacts of social isolation as well. There are obviously strong links with depression and anxiety, and links with suicidal behaviours as well. And it also leads to poorer cognitive function and increased risk of dementia. So as part of our sort of 7-point plan back in 2022 to try and turn things around and manage the pressures we were under, we didn't just turn digital and look at total triage and build a women's health team and try and improve continuity. We thought, how can we help our community lead healthier lives? How can we work with our community leaders and community organisations to improve outcomes? And that's why I'm going to hand over to John, and we'll see if we can find some slides to share. I might not be able to, I'm sorry, looking at this screen. But John.
I think we're good. So, social sort of prescribing that we really decided to call sort of wellbeing support in the surgery, because no one really knew what social prescribing was as a description. So we've got a number of different things that we offer. As Tim's already said, Georgie, our wellbeing advisor, is due back from maternity leave in February and has done some fantastic work. One of the things you'll see on our website is our wellbeing wall, and then we have a physical wellbeing wall as you come in through the front entrance hall. The reason for doing that was that there are actually so many good services out there from the voluntary sector, from lots of different organisations, but actually knowing about a lot of these things is quite difficult because things change so much so quickly. We just wanted to have a central sort of point that we could advertise these things. So the wellbeing wall has been really useful for patients to access via the website and see visually, but also it's really good for us because we've got a central place now that we know have got up-to-date services on. There's some really brilliant things on there. One of the ones that we've been utilising recently is through the Nuffield gyms, where they're offering some real good joint rehabilitation classes, and that's brilliant for people because it doesn't cost anything, and actually, we know there's a long wait for NHS physio services, so actually being able to have some guided exercise classes is really good for supporting people's well-being. So I know Tim's spoken about the CAB service here that is fantastic, and when we initially started talking about being on the trial site for it, quite naively I didn't really know what systems advice did, and I'm amazed at the advice and stuff they can give. Their main, so we have Nagmani based here at the surgery, so he is allocated to us and just works for us here at the surgery, so we have someone full-time to support our patients. And the main areas he looks after are assisted people with debt, assisted people with benefits, housing. He can also give some advice around sort of family and law, and around sort of when there's issues that need resolving. But actually, the knowledge that the CAB have is absolutely fantastic. And one of the things that really I think I learned about them is they actually have what are referred to as professional form fillers, so people that specialise in helping with applications for children that need support at school, or for care grants, that sort of thing. And actually having someone that knows how to fill in a form properly to get the help you need is amazing, because a lot of people, certainly a lot of patients we've come across, big events have happened in their lives, and they're suddenly having to fill in all these forms, and just having someone to guide that is fantastic. I mean, from using a few examples from the CAB service, one of the things that I think we've all heard about in the headlines for a very long time is things like black mold and how that affects patients' health. But Nagmani's worked really hard integrating with the local councils and house associations to help a number of our quite vulnerable patients who were presented to us multiple times with quite severe health issues purely because of their living environments, and so having someone that can support them in doing that is life-changing to some of our patients. And the great thing with Nagmani is that he doesn't have a set sort of appointment time, if that makes sense. So actually, if he will speak to patients on the phone initially, find out what they need, and then we'll invite them in for a face-to-face appointment. And I've known some patients be with him for 3 hours, and he puts that time aside. You're not made to feel that you're rushed, because he knows exactly how long some of these things take. And I think that works really well alongside us. And it also, from CAB's perspective, they require sometimes medical evidence to support their letters. So having them integrated with us is we can work really well together to do those. Even down to the applying for a blue badge, the process seems to change on a monthly basis, where CAB are completely up to date with what they need and how to go about that. So I see them as a massive part of the surgery, and if the funding was ever to stop and they weren't here, I think we'd all be lost without them. It feels a very, very integrated part of our service. So there's just we've seen some really brilliant examples and feedback from patients that have had time with Nagmani has been absolutely brilliant, and it's I know he feels he has a really rewarding role, and I think for working for CAB you've got to be someone with a lot of passion anyway to help people, but no, it really works well alongside what we do. So that's one big element of our social sort of prescribing side of the surgery. But I mean, we've also in late September, we held our first carers support group at the surgery. So we used the meeting room next door in the hospital, and we called it the Hive, and it's a space for carers to come to share experiences and sort of feel supported. we had a really good turnout for the first meeting. There will be another one in the new year. It was really useful to get some feedback from the people that came to that one to find out actually what they want, because we start up a group, and we don't, it's not for me to decide on paper what people want. So it was really good to have some feedback. So we're using that feedback to build those sessions going forward. And we've set up a carers specific email group for carers so we could share information. Again, there was things that we discussed at that meeting that people that had been carers for years didn't know they were entitled to, or didn't know were available on the doorstep. So it's just sharing that information. So yeah, that'll be a big part of Georgie's work when she comes back. And it was a really useful experience to have that first group, just to understand what people wanted, because we want to, we organise it because we want to give carers that support, but actually letting them tell us what they need is what we really want, because there's no point in me sort of deciding myself. So that's been really useful. We've also had some really other good sort of engagements. There's an organisation called Sports in Mind, that is a charity-based organisation, but they're absolutely fantastic, and they've got lots of different services just to help people with their mental well-being. So one of the things that I referred to recently was a horse grooming course at stables, and actually just having that time once a week to go and spend with animals and just switch off their minds is fantastic, and actually that's just as much treatment as prescribing a tablet to help with mood. I'd much rather someone could have that interaction with an animal and feel supported. So having those services available, and again, these are all things that we've learned about along the way, and it's brilliant to know that they're available for people. One of our looking forward, one of the other groups we'd really like to look at is, we know that there's a real need for support groups for parents and adults alike, that and children that are awaiting diagnosis for a neurodiversity, because there is there has been historically a long waiting list for that, and actually about sharing that knowledge. So we're looking at how we could set that up, and again what that will look like, and how it work for the people that want to attend. So we need to be aware that a lot of people that would like to attend that group would have school-age children. So it's making sure if we run something, it fits in and works around timings that would work for them. So that's something that's certainly in the pipeline that we hope to launch next year. I think from a general wellbeing point of view, I heard you already mention like the Thrive project and mental health. It's looking at that holistic, all-round sort of approach to healthcare that's really good, and certainly I think they really go hand in hand. And we've seen some really good results. It's quite difficult sometimes to put a marker on it, but we've had patients that probably historically we would have started on antidepressants or medications and that sort of thing, and actually by being able to give them support at the right time in a way that suits them, we've avoided putting them on medicine. That is just a bigger part of a job in general practice is taking people off medicines and for the right reasons than just giving them a tablet. So I think that's that's a really positive.
Well, I think, John, if someone came up to you and said, I've got a pill that will reduce your risk of a heart attack by almost 30%, risk of stroke by 20%, it will reduce your risk of depression, it will boost your immune system, and we get a lot of questions about how do I boost my immune system, and you said, what is it? And I said, it's social connection. That's quite powerful. We're interested in green social prescribing here as well. Part of that is restoring people's connection to the environment, and part of that is acknowledging that probably a lot of our ill health comes from our detachment from the environment. It won't surprise many people to know that if you live in a city and you live more than 800 yards from a green space, you're twice as likely to get antidepressants from your GP as if you live close to the park in a city. Children who have trees in school have average higher IQs. So everybody benefits from nature, and everybody benefits from social engagement.
So no, it's a real key part. So no, I think we certainly I think as a sort of percentage mark of the provision we offer, that we see that the social, the holistic, that side of things really makes up a real key part of general practice where probably, when I joined, and historically it was very much medicine is here, isn't it, and other things elsewhere. So it's a real good mix there.
I think you're right. I mean, one thing I learned from the NHS Health Inequalities team and Professor Sir Michael Marmot is that your health, anyone who's watching this, we can probably, as the NHS, help you with 20 to 30% of what you deem as your health. 70 to 80% is actually determined by your environment. And this is an area that we're trying to expand into. And so it was very much that we just did pills and we did blood pressure. But now we can see the direction of travel. The research and the evidence base here is very, very powerful. And if we can help people connect and reduce their risk of serious health outcomes, then why wouldn't we?
And I think just giving people a place to actually share experiences. There is no one better to learn something about a condition or a situation you find yourself in than actually speaking to someone else that has found themselves in that in the past or is going through it as well. And actually that, the information I hear shared between people is so much more than I know. The example of the carers group, just hearing the conversation going on around the table, just realise that that is part of it, just getting those people together.
We can't fix, but we can facilitate.
Yeah, exactly. Exactly.
And that's where we're at. And as John said, we want to build services around you. So please, either on this, was it a post or a timeline? I'm showing my age. Or email us at the surgery. Please tell us where you think, number one, that we could be working with other people in the community and highlighting some of the great work that's going on out there. And number two is, what kind of services do you want to see developing here at the surgery as well? So feedback is very, very important to us. And we would like to build services around what you need. So please tell us.
And certainly if you know of anything that is local that we aren't aware of, we've got our online wellbeing wall, we've got our physical wellbeing wall in the reception. We're very happy to advertise that. You'll probably see when you've been into the surgery our patient calling screen. There's all sorts of adverts for things on there, and most of those are people have sent me an email in saying, oh, I was in the surgery that day, do you know about this? And we put things up. There's a carers support group for people that are supporting people with cancer that's held at the Excel Centre. It's just a coffee morning drop-in, but actually, if we can advertise those things and one person goes to it and gets something out of it, it's fantastic.
Yeah, it's well done, isn't it? Thank you.
You're very welcome.
I don't see any further questions here, and we've been rabbiting on for I've been rabbiting on, for almost an hour. So I think we'll close it there. And the message from the surgery is that we want to wish you all a very healthy and happy Christmas. We're looking forward to the new year. We'll take those challenges head on here, and we'll keep trying to develop the offering that we've got for you, and we'll keep trying to develop the service here too. But there's another message, particularly at Christmas, which is social isolation actually kills. So please check on your neighbours, please check on your family, please get involved in your community, please tell us how we can do a better job, and we'll all look forward to seeing you in the new year.